All right, so we're going to go ahead and get started. Hello and welcome to JWI's National Alliance December webinar offering. Thank you so much for joining us. My name is Anna Gerstein, JWI's program manager who oversees the National Alliance. Before we get started, just a couple of housekeeping notes. Please keep the Q&A box for any questions you have for any of our panelists, and we'll do our best to address them during the latter part of the webinar, time permitting. This webinar is being recorded and a recording will be emailed out in the coming days, along with the transcripts, resources, and slides. Additionally, if you are interested in receiving a professional development certificate, please make sure to fill out the form linked in our follow-up email. Today's webinar offering is Reproductive Coercion in the Post-Roe Landscape, presented by Dorian Karp and Mariam Durrani. Mariam Durrani has served as the Vice President of Policy and working at the National Domestic Violence Hotline since 2022. She has a background in working with survivors of domestic violence with a focus on immigrant and faith-based communities and limited English speakers. Her experience includes working as the Policy Director for the National Resource Center on Domestic Violence, Senior Policy Attorney at the National Network to End Domestic Violence, and also a legal fellow at the Virginia Poverty Law Center. She has litigated family law and protective order cases in both Washington, D.C. and Northern Virginia, and has worked as a legal assistant for victims' attorney. She has also worked for the U.S. House Judiciary Committee and is a certified mediator. She is a graduate of the University of Richmond School of Law and bar to practice in Virginia. Dorian Karp serves as the Director of Policy at the National Domestic Violence Hotline. She has a background in working to end gender-based violence, gun violence, and gender inequality. Previously, she has worked as the Director of Policy and Advocacy at Jewish Women International, where she focused on federal advocacy, grassroots engagement, and coalition leadership. Before moving to DC, she spent nearly a decade in the state government, the nonprofit sector, and political campaigns. Dorian received her master's in public administration from the University of South Florida in 2016 and holds a BA from Barnard College at Columbia University. We at JWI are so thankful that they are joining us today to share their wealth of knowledge. Before we begin, I want to inform everyone about this study that the University of Kentucky is conducting on 3 key topics and would like to draw your expertise to gather insights and help inform and educate others. For the current study, they are hoping to talk to a variety of professionals who work with people exposed to interpersonal violence about the support and needs of individuals as they engage in recovery and safety planning. In particular, they are asking about coercive control and how it plays in interpersonal violence victimization and safety concerns. The survey can be done by Zoom or phone, whichever is preferred. The survey takes about 30 minutes to complete. If you have any questions or are interested in participating, please feel free to call or text them at 859-407-6015 or scan the QR code on the side. I'm now going to turn it over to Dorian and Mariam. Thank you so much for being here with us today.
Thanks, Anna. It's a pleasure to be here with everyone and be back in my old stomping grounds at JWI, but only for an hour and a half. So really thankful that Anna and the rest of the team thought of me and that I'm able to bring Mariam with me in this space. We are here to talk about our 2024 Reproductive Coercion and Abuse Report. At the hotline, we provide 24-hour, 7-day-a-week, 365 services where we answer calls, chats, and texts from survivors, their helpers, and anyone else that needs to learn something or needs safety planning or needs help regarding an intimate partner violence or an intimate partner issue that they're having. We are really thankful to also be able to do research projects at the hotline. About once or twice a year, we create a focus survey along with partners who are experts in the area that we are we're doing the research in. And so earlier in the year, we were able to finalize a report with If, When, How to look at reproductive coercion and abuse. And we're really pleased to be able to present it here. Mariam, is there anything else you'd like to add to that? before we
I
get going?
think those are the most important pieces. I would encourage everyone to go to our website because there are a lot of great resources and tools on there. You can find us at thehotline.org. Another thing that could be valuable that not everyone knows is that all of our resources are also available on our website. If you click that Get Help button in the middle of the page, we have over 5,000 resources that are everything. They're split into shelter and then other resources. So those are all accessible for everyone there. And if you go to the top right navigation bar there and click on for stakeholders and download request materials, at the very bottom of that page are all of our recent surveys. So there may be other ones that interest you as well. We have things on survivor experience with law enforcement, online abuse and harassment, we are soon going to be releasing one on firearms, which could also be really valuable to you. And I just wanted to flag our partners with If, When, How could not be with us today. They are amazing, and we are going to be sharing some of their resources as well in this presentation. We do have a few slides from them that is their proprietary information and part of their presentation. So just want to honor that as well. And also encourage you to check them out as a resource in particular. If you are doing anything at all in the reproductive world, they are fantastic. And we'll share a little bit more about their specifics later. Starting with what this survey is. Between October and December of 2023, the National Domestic Violence Hotline conducted a survey to learn about survivor experiences with reproductive coercion and abuse. And we actually defined that in the survey, so there was no confusion. We defined reproductive coercion as the use of violence, sexual assault, manipulation, birth control sabotage, threats, and any other means by an intimate partner to force or coerce pregnancy or pregnancy outcome. When an intimate partner coerces their partner into becoming pregnant, they increase their means of control over that partner and their ties to that partner. Pregnancy and, of course, subsequent childbirth also heightens the survivor's risk of abuse, of injury, of violence, and often can be a period of escalation at times when a partner who chooses to cause harm or an abusive partner feels like maybe they're losing control. We also know that adolescents and young adults in particular are especially vulnerable to and likely to experience reproductive coercion. So, the Hotline survey is actually the first national survey of its kind since the US Supreme Court reversed Roe v. Wade that captures survivor experiences with reproductive coercion in this really new and challenging landscape where, even obtaining straightforward healthcare resources are now challenging for survivors. The other thing that I would flag is this survey is very heavy. It is one of the first surveys that we did where we included, I believe, the most survivor stories that we ever have in the history of the hotline. A lot of those are actually captured within this presentation itself. So if you do not want to listen to that, feel free to step away whenever you need to. Feel free to take breaks. I know this is also being recorded, so feel free to stop at any time and make sure that you are taking care of yourself because this brings up a lot of different pieces for a lot of different people. But we really want to honor those survivor experiences and really use those to inspire change and hopefully encourage people to take the recommendations very seriously. So the survey was actually conducted on the hotline's website. We collected both qualitative and quantitative data. Our responses are anonymous, and we collect no identifying information, and folks can choose whether they want to report their demographic information. So we actually only release what is completed. There are plenty of people who start the survey, don't finish it, things like that. So it's 3,431 people who actually completed the survey in its entirety. So something that we also did in this survey is we hypothesized that people may not always understand what reproductive coercion and reproductive abuse means. And that can also be the same for how survivors identify themselves. So 74% of the people who took the survey identified explicitly as a survivor of domestic violence, sexual assaults, or gender-based violence. Another thing that I think is really interesting for advocacy and also important for learnings is that 17% of those that did not explicitly identify as a survivor indicated that they actually had experienced sexual coercion throughout the survey. So I think really important in terms of how we do our advocacy and how people may choose to identify themselves and even categorize their own experience, which also makes it really important for how you get services, how you get support, what sorts of programs you may be eligible for. So that was a really interesting distinction. The demographic information that we captured also showed primarily that the respondents identified as white individuals at 65%, 15% at Latinx, 15% as Black, 5% as Asian, 4% as Native American or Alaska Native, 2% as Arab or Middle Eastern, 1% as Native Hawaiian, 1% as Pacific Islander, and 7% felt their ethnicity was not listed. In terms of gender, the overwhelming population that responded to the survey identified as female at 86%, 8% identified as male, and 6% identified as non-binary, transgender, two-spirit, or other. Again, the largest demographic that responded to the age number was between 34 and 45 at 31%, followed by 25 to 33 at 25%, and then at 13%, both 13 to 18 and 19 to 24, and smaller numbers at 40. This is so small. Sorry, you all. You will also receive a copy of this at 46 to 51 at 8%, 7% at 52 to 63, 2% at 64 and over, and then a very small number who even identified as under 13 at 1%. A large amount of individuals identified as heterosexual or straight, 64% of those. 6% identified as asexual, 15% identified as bisexual, and 1% identified as gay. And I thought those were so interesting in how people reflected that in their stories and what it meant for their experiences of coercion. Next slide, please. And I'll turn it over to Dorian.
Great, thanks, Miriam. So we already mentioned kind of the important court decision overturning Roe v. Wade, which was Dobbs, of course. But we know that kind of even before Dobbs, there were a lot of state restrictions that were imposed on people being able to successfully access reproductive health care and also healthcare more generally. So there's a whole list here, right? So under the Hyde Amendment, state Medicaid programs can't use federal money to cover low-income people's abortion care. And JWI has been working on that for a long time, as have a lot of other organizations trying to repeal Hyde. The Hyde Amendment affects Indian Health Service, military insurance, federal employees, and 25 states also restrict private coverage of abortion care. 36 states require either parental involvement or the young person has to go before a judge to get a judicial bypass, forcing young people to navigate taking time off from school, finding transportation, and learning how to go to court, filing a petition for judicial bypass. It's a pretty high barrier, right, to be able to do such a thing, or their ability to find a lawyer to help navigate that process. When we're looking at people who are incarcerated in the criminal justice system, we can look at how many incarcerated individuals are survivors of intimate partner violence. And incarcerated people, despite having a constitutional right to basic health needs, have been denied the full spectrum of reproductive care, from delivering babies alone in their cells to receiving no miscarriage care, to being shackled during childbirth, coercive sterilization, to being denied abortion care. Trap laws that are listed here are targeted regulation of abortion providers. And they limit the ability of abortion clinics in states where abortion is allowed to operate and provide care, regulating them more severely and without reason. Trap laws include laws that require abortion clinics to operate like surgical centers, to be under onerous reporting and inspection requirements, and more. I remember a few years ago, I think maybe Texas was trying to do this, and they were regulating how wide the hallway had to be in clinics that provided abortion, so that a gurney would be able to be wheeled down, like in a hospital setting. When of course that's not the use case of how these clinics operate, right? And so therefore denying the ability for these clinics to work in the space that they are currently operating in. So really innovative, terrible laws that restricted clinics to be able to perform abortions and people to be able to access them. We've seen that states have enacted numerous laws that make people have to jump through medically unnecessary hoops that force delay and often require more than one trip to a clinic. These are things like waiting periods of 24 to 72 hours before someone can get an abortion, having to sit through a script that providers are required to read, and having to get unnecessary and invasive ultrasounds. These are just a few of the laws and types of laws that exist all across the country, and that have existed for a long time post-Roe. This is from a report that If, When, How conducted to really better understand who was being targeted by criminalization and how the cases made their way into and through the criminal process. Most adult cases involve the criminalization of the person for allegedly self-managing their own abortion, but a notable 26% involved those who helped others self-manage. So here you see that from 2000 to 2020, so over 20 years, at least 61 people were criminally investigated or arrested for allegedly ending their own pregnancy or helping someone. People who are already targets of state violence because of their race, income status, or being further along in their pregnancy were also the main targets of the cases that were documented. Additionally, while If, When, How does have documentation of people using a variety of methods to self-manage, the majority, 52% of the adult cases, involve the exclusive use of abortion medication. And here we are post-Dobbs, where there is even kind of greater authority provided to states that want to deny access to abortion and reproductive health care more generally. We have more state-generated barriers to reproductive health care, with 14 states enforcing near total bans on abortion care as of March 1st. On the other hand, we also do see a lot of states with more Democratic leaning legislatures and governors that are making sure they're putting in their constitutions, or the populace is voting on measures to enshrine abortion access and reproductive health care access. So we're seeing it on both ends. But obviously that's leaving a lot of women, female identifying folks, people that may need these kinds of supports and services without them. Generally speaking, most of the new or newly in effect abortion bans post-Dobbs make it a crime to provide or perform an abortion. They do not make it a crime for someone to have an abortion. And most make that explicit in the statute, but some don't. And since If, When, How wrote their report, Arizona Supreme Court upheld an 1864 abortion ban, went into effect on June 8th, but was repealed, and Florida's 6-week abortion ban was upheld and has been in effect since March. The laws that I've been talking about, right, they make it a crime for healthcare providers to provide abortions. While those bans typically don't target the people who have the abortions, many people don't know that, right? They're not reading the statute very seriously. Where do we even find it? And what do all those words on the page mean? So it makes them fear the criminal punishment that they may undergo for having an abortion. And also fear family regulation systems involvement. The Repro Legal Helpline is run by If, When, How, and they receive questions about this every day. I mentioned it briefly in one of the previous slides, but we want to really make sure that in this conversation, we're talking about how the impact of these laws, the risk and fear and punishment, how they mostly falls on Black people, Indigenous people, Latinx people, youth, immigrants, transgender and gender nonconforming people, people who hold intersecting identities, and how particularly dangerous ramifications of the legal landscape for pregnant abuse survivors who are both obvious and immediate. One of the quotes from the report, as Mary mentioned, we'll be doing a lot of these in the voice of the survivors who provided this content. So just naming that. They said, my ex-husband prevented me from accessing an abortion. We lived in a small town in Georgia, and I had to travel to Atlanta for it. He split my car tires and more. Sending it back to Miriam.
So turning back to the specifics of the survey, we split the survey questions into behaviors. So you're going to see that reflected in the responses. So a significant majority, 63% of all of the respondents said their current or former partner pressured or forced them to have sex or other sexual activity when they didn't want to. And that actually increases to 76% for those who explicitly identified as survivors of gender-based violence. And 39% said their current or former partner threatened them if they said no to sex or other sexual activity. So again, we have 2 quotes from survivors. A former partner told me if I did not have sex with him, he'd call a group of his friends and all 6 of them would rape me. He made a joke, mocking me for having a small pocket knife to protect myself. I had to allow him to have sex with me, sex I didn't want with me, figuring bearing it would be better than fighting 6. Another quote says, I was young. He was 5 years older. He was controlling. If you love me, you'll do this. He'd drink and got aggressive. We'd argue, fight, get physical. Then he'd force me to have makeup sex. If I wouldn't have makeup sex, he'd take my birth control from my purse or hide it. Often he'd kick me out of the house if I didn't have sex with him. Put out or get out were his exact words. So again, really dangerous and horrifying behavior from partners that want to use sex and sexual activity as a true tool of control and really threaten their partners with manipulation, harassment, violence, and all of those pieces. Next slide, please. So looking more specifically at birth control, STI, STD, and pregnancy prevention methods, 23% of respondents said their current or former partner knowingly exposed them to an STI/STD. A survivor reported, "When I found out I was pregnant with our daughter, my ex-husband informed me he had an STD. When I became upset that he had not told me about it before then, he threatened to throw me down the stairs in our home to make me have a miscarriage." 37% said their current or former partner refused to or prevented them from using condoms, diaphragms, or STI/STD prevention methods. So another survivor said he would do a cycle of refusing to wear condoms or letting me use sperm-killing gel to prevent pregnancy, would sneakily remove the condom he'd put on, or finish inside of me without my knowledge or permission, swore he didn't know if he came, wasn't sure where he came, didn't come at all. So again, really, really frustrating experience for that survivor. Next slide, please. 20% said their current or former partner prevented them from using birth control at all. So that's things like pills, patches, rings, IUDs, other things. 24% said their partner destroyed it. 21% said their partner hid it. 20% said they tampered it. 32% withheld it. A survivor story said, "I wanted an IUD after trying several other methods of birth control. My ex/abuser was extremely against me getting an IUD. After I got an IUD against his wishes, there was an extended period of heightened abuse and neglect. He voiced his belief that my choice for my body were unfair to him because they were against his wishes and prevented him from having children if and when he wanted them." The story at the bottom of the page shares an experience from a survivor who said they were 16 years old. "I became involved with a controlling partner. He removed the condom behind my back multiple times. Since I was young, I could not tell at those times. I ended up pregnant. I was not given the option of abortion and was coerced by my partner and his family to keep the baby. I am an intelligent and strong two-spirit woman. Because of this man, the promising plans I had for myself in the future were taken away from me." Next slide, please. I'll turn it back over to you, Dorian.
It's helpful if I unmute myself. Thank you, Miriam. I think one of the takeaways of this report, as we're moving through it, is what I think all of us, most of us on this call know, which is abusive partners will use any tool they have to coerce and control. And whatever their desire is, they will try to enact it, right? So we see throughout this report abusive partners trying to get their partners pregnant when they don't want to be, trying to create or force miscarriage when a partner is pregnant and wants to be pregnant, right? Like stopping them from having an abortion, forcing them to have abortions. I mean, like it runs the gamut, right? Of just whatever their desire is, they're trying to enact that on the survivor, on the partner, without honoring obviously what they want. So just I think that is just like a general framing. It's just like because you'll see abusive partners doing a variety of different things throughout the report. Here we see that 7% of the respondents said that their current or former partner prevented them from using medication abortion to have an abortion. We're talking here about medication abortion being the pills that can be ingested to end a pregnancy. So following up on pregnancy prevention methods, right? To really thinking here now about medication abortion. And of those 7%, 23% say that their partner destroyed the medication, 20% said they hid it, 13% said that it was tampered with, and 37% said that it was withheld. These quotes here are, I think, some of the most jarring. When Miriam and I were going through the report, we were really taken aback by these. Survivors said that their current or former partner prevented them from using medication, abortion, in the following ways: that their abusive partner used emotional manipulation and begged them not to have an abortion, or else the abusive partner would commit suicide. One survivor said that they lit the medication on fire. Another said that the abusive partner locked me up so I couldn't get an abortion, go get it. And lastly, one of the survivors said that it threatened mine and my family's lives if I got an abortion. So more in this section of birth control, STI, STD, and pregnancy prevention. We found that 23% of the respondents said that that their partner pressured them into becoming pregnant. So a quote is, got me pregnant deliberately against my will after I made it clear I didn't want kids. I believe he did it to keep me trapped and tied to him. We found that 13% of the respondents said that their current or former partner pressured or forced them to terminate a pregnancy. Right, so this was what I was preluding earlier. A survivor said, I had a boyfriend who did not force me to get pregnant, but it happened even with a condom. And they forced me to have an abortion and then flipped and called me the devil and blamed me for everything. 9% of the respondents said that their current or former partner used or threatened violence if they wanted to or were trying to terminate a pregnancy. So we see here a survivor said, he asked me what I would do if I was pregnant. And before I answered, he said he would kill me if I had an abortion. At the time, I didn't take him seriously, but as I got to know him better, I realized he probably meant it. Luckily, I had good friends and a counselor who helped me see the relationship was unhealthy, and I got out before it was too late. I have never heard of reproductive abuse before seeing this survey on Instagram. I feel validated that this is a thing. Thank you. I'm going to stop here and just say, I think we saw that in one of the first quotes that Miriam was talking about the people identifying as a survivor of gender-based violence. And then the other, I think, 17% of folks who filled out questions as they were going through that we identified, as researchers, as advocates, as having experienced some form of sexual coercion, reproductive coercion. And here you see that, right? Like there's a powerful to provide language and context for people that are going through this. And we have, I think, as a movement, a lot more work to do to get this out there and have people understand their lived experience in this way. For some people, it can be empowering and feel very validating. Last percent on this slide is that we found 13% of the respondents said their current or former partner used or threatened violence while they were pregnant with the intention of ending the pregnancy. We also looked at criminalization and threats, kind of in response to Dobbs. And as we were seeing states creating a lot of these laws that criminalized providers, we wanted to see how survivors were understanding those things and what their experience was. So we found that 5% of respondents indicated that their current or former partner threatened to report them to the police or other legal authorities for considering or having an abortion. We found that 5% of the respondents said that their current or former partner threatened to take them to court or sue them if they had or wanted an abortion. and that 12% indicated that their current or former partner used a previous abortion against them in some way. So 5% we usually think about not being that much. But as we're thinking about 5% of this sample, we're talking about a couple hundred people um, who who had these experiences only a few years after these laws were in place, right? And so I think we can think about how these numbers are going to grow as more states create these laws, and as they become like more popular, how they're implemented will impact right, how abusive partners are using these laws to threaten and coerce their survivors that are living in these states and in these places. One of the survivors says, during my relationship with my abuser, he would force me to have unprotected sex so I could have more children to further my financial and economic abuse, making it harder for me to leave. During the beginning of our relationships, I had 2 abortions. The first he financed, and the second he refused. I had to come up with the money myself, whichever way I could, and later he accused me, saying that wasn't his baby. That's why I had an abortion, to cover up. He used that as an excuse to mentally, verbally, emotionally, and at times physically abuse me throughout our relationship. During our relationship, he also knowingly transferred an STD to me to further punish me. That reminds me, of course, we're seeing here, we did that STD slide and stat a few slides ago. But we know that abusive partners are using a variety of these tactics to exert their control in these relationships. Here's one of the if when how slides that we had flagged earlier, and I had mentioned their Repro Legal helpline. Their legal services, they provide free and confidential legal services for people's reproductive life, including abortion, pregnancy loss, and birth. They are an amazing resource for people, for advocates, and folks with lived experiences of abuse, survivors themselves, to be able to access. They have a wealth of information and knowledge to provide, particularly around like the legal aspects, what these policies actually say, what criminalization actually looks like, and what one can expect on the ground. And If One How also has a Repro Legal Defense Fund that can provide support for anyone in the United States facing legal consequences for abortion, miscarriage, stillbirth, or other pregnancy outcomes. So this is also a really important and good resource for folks to know about. If you're working with a survivor, or you know of a survivor that's facing any of these legal challenges or criminalization, you or they can reach out to the Repro Legal Defense Fund for support. Miriam, is there anything on either the Defense Fund or the helpline that you wanted to add as an attorney?
I think those are the most important pieces, but the people who literally answer the phone and answer the emails are all attorneys, so they can provide a lot of incredible, accurate information that is research based in terms of what someone can and cannot do in their state, and come up with those safety planning strategies that help someone figure out whether they are trying to stay within the law, or they're going to be outside of the law, or somewhere in between. So I think that if there are any questions about the legal implication of certain actions, that is the best resource to reach out to.
I knew you had something to add. Thank you, Miriam.
So, in the last part of our survey, we turned to healthcare access generally because we know that reproductive health care, for particularly for people with uteruses and who give birth, really have a lot of implications on their primary health, secondary health, a lot of these intersections. So we wanted to know what was preventing respondents from accessing a doctor or nurse practitioner who focuses on reproductive health or pregnancy. And we saw these barriers from both female identified individuals, male identified individuals, and other people with other gender identities. So you see kind of the intersections where this plays out. So the largest two responses was you're unable to make or find time to visit a doctor or nurse practitioner for reproductive health care, just flagging that this reproductive coercion and abuse experience fits into all of the intersections of gender-based violence, but a huge part is economics. So financial abuse, economic abuse, but also economic resources and economic instability. We in this country do not have guaranteed paid leave really in any capacity. There is, of course, FMLA, but those have very, very specific practices and nuanced things you have to follow and employer sizes. So if someone just needs to casually take off to go to the doctor and address a reproductive healthcare issue, that means jeopardizing their job, which could jeopardize their income, which could jeopardize their whole life and their family. So a lot of intersectional challenges there and good to think about in terms of how it connects to the different parts of our advocacy. Another 24% said that they did not have healthcare coverage at all. So another unfortunate piece is that healthcare isn't tied to employment, and some people don't have that. A lot of states don't have any sort of gap coverage, and Medicare does not always address, Medicaid does not address all of those pieces. So again, a lot of challenges. 21% said that they could not afford a visit to the doctor or nurse practitioner. And then, sorry, I skipped over the largest one because it's super tiny, but you'll get these in slide format. 31% said that they had not found a provider that they trust, that validates their experience, or that they want to see for reproductive healthcare services. So another really, really important piece of their experience. Sorry, Dorian, can you skip ahead one slide? I went to the slide in advance. Very sorry. I'm reading off a different slide. You are likely to have no idea what I'm talking about. But this was the question about what is preventing people from accessing the reproductive health care. Another important factor is that 22% of respondents said their current or former partner tried to accompany them to or accompany them to an appointment to influence or control the appointment. 12% said that their current or former partner forced them to cancel or change appointments to their OB/GYN or clinic. So 4% actually reported that their appointment was canceled or changed to their OB/GYN or reproductive healthcare clinic without their knowledge. 7% denied or restricted access to their prenatal medication or testing. 12% forced them to cancel or change an appointment to the OB/GYN or reproductive healthcare clinic. 22% tried to accompany them to an appointment to influence or control the appointment. So again, we see all the different ways that abusive partners are trying to control their partner. And if we could go back now, please. Thank you. So 61% said that they have access to a medical professional who does focus on reproductive health care or pregnancy. The most used services, 81% are gynecological exams, 52 for birth control, 48 for STI and STD testing and treatment. So it does seem like when healthcare is available and accessible, people use it for their healthcare needs. Surprise. So I mentioned earlier in advance, you had a preview that 32% of respondents said that they did not have access to a medical professional who focuses on reproductive health or pregnancy. And the most common reason being that they haven't found a provider that they trust, validates their experience, or that they want to see for services. And then all of the different components that I explained on the next slide. So please go next. So again, the variety of different reasons. And the next slide, please. So we already addressed the fact that many respondents said that their current or former partner tried to accompany them and force them to cancel or change these pieces. Um, but the story from the survivor says, my husband had taken my birth control because he told me it was making me gain weight. He has come to my OB-GYN appointments expecting to talk to the doctor about my birth control. He has cheated multiple times and forced me to continue to have unprotected sex. So again, lots of really different challenges with trying to accompany people to appointments, canceling the appointments, restricting access, uh, and just really, really frustrating experiences that survivors have to go through just to get their basic healthcare needs met and their reproductive lives taken care of. Next slide, please. So we're coming to the end of our presentation where we think about recommendations and what this means for survivors at large. I think that's something that felt really left out of the conversation that we really tried to address in our survey, in the recommendations, and in the overall experience of what it looks like to live in a post-ops landscape was the survivor experience in particular, and how critical reproductive autonomy is, particularly for survivor safety. Everyone should have access to the autonomy and freedom to make their own reproductive decisions, but control over our individual reproductive lives also means that neither the state nor an abusive partner should have the power to regulate reproductive decisions. That autonomy is really also critical to living a life free from violence. So we have recommended that states repeal abortion restrictions, end healthcare disparities, and take immediate action to eliminate the possibility of criminalization of civil suits against people who end their pregnancies or experience miscarriage and stillbirth. And unfortunately, we see with this issue becoming so politicized and really varying from state to state, that lots of states want to make examples of people who end their pregnancy, whether they choose to do it on their own, but even if they have a miscarriage or stillbirth, and now we're seeing the direct complications and sometimes even death of individuals based on those restrictions. And the pressure that a lot of the systems face to uphold legal requirements which put literal lives at risk and in jeopardy. So states should also provide a right to seek redress for people wrongfully criminalized for ending their pregnancy outcomes. So prosecutors are disincentivized from going after them. We know that it's a huge issue for prosecutors who take this on and want to, prosecute people for things that are very straightforward. Reproductive coercion is prevalent, it's dangerous, it's enabled by state restrictions on reproductive health care. I think it's important to go back to what Dorian mentioned that is the piece that F1 really dives into about state-sponsored barriers to abortion. Those were not new. Those existed before Roe, and they still continue to exist. And now they're just being codified and actually acted upon in a much more thoughtful and insidious way all across the country. So we really need to, again, elevate the voices and experiences of survivors related to reproductive coercion to ensure we're providing them the information, resources, support, and services they need. So that is also why we really wanted to center survivor stories and their experiences in this. We know survivors are the master of their own journey and often know exactly what they need to stay safe or what would help them. So we really just need to listen and elevate their voices. So the last quote on the slide is, I was in a physically and sexually abusive relationship. He was withholding my birth control and refusing to use a condom when he raped me. I escaped from the relationship and filed a police report. I was 5 weeks late with my period. I ended up not becoming pregnant, but was relieved that I was in a state where I would easily be able to get an abortion if I were. He had the money and means to chase me down if I were pregnant. He had told me before he would kill me if I ever had an abortion. If I ever had a child, he would try as hard as possible to gain custody of the child. So we see the ways that something like a pregnancy can entangle a survivor with someone potentially dangerous for a very, very long period of time, and how an abusive partner can then use a child to further harm the whole family and the survivor themselves. So that brings us to the end. I think we've given you as deep of a dive on the survey results as possible, but I encourage you to definitely take a look at the survey on the hotline page itself and download it. There's a lot of incredible graphics, but there's a lot more incredible stories in there. And I think so. Again, our partners at One House did a really good job on laying out the legal landscape in the before and after that we actually dive into in the survey for the setup. But would love to hear from you all and questions. So Anna, let us know how to proceed with that.
Perfect. Thank you so much for sharing your insightful knowledge with us today. We will be transitioning to the Q&A portion of today's webinar. So if you have any questions, you can put them in the Q&A or in the chat, and I will read them aloud and see. Oh, I see one already. Oh, thank you so much. Monty says thank you, and this presentation was amazing. Yeah, so if you have any questions, please put them in the Q&A or send them to me directly, and I'll give us a few minutes to put those in there. Also, I do want to just remind everyone to not put any confidential information in there, as attendees can see your comments, so just be aware of that as well.
I think it would also be helpful to hear from you all if you feel like there are any innovative practices that you are seeing in your own advocacy or in your own communities that addresses reproductive coercion and abuse, that would be helpful to share. Or also if there are particular challenges that you're struggling with, those would also be good to hear too. The landscape looks really different in every place across the country. And we know that people are getting really creative and doing a lot of incredible work, even in these seemingly really bleak times. So I think that that community learning is also really valuable when we talk about what we can do.
I just got one question sent to me from Judy, who's asking, how can policymakers and healthcare providers effectively support individuals who experience reproductive coercion in the wake of the changes to abortion laws post-Roe?
I think some of that initial support is just making sure that that survivor that they are interacting with has resources. That was a really positive introduction that happened in the VAWA reauthorization passed was the introduction of IPV screening during healthcare appointments. So people don't necessarily connect reproductive violence to the larger experience of gender-based violence. And I think it's really important that practitioners are aware and educated on those pieces. So once that connection is made, it needs to be a little bit more deeper than, are you safe at home? Because someone may feel safe at home, but they may still be experiencing manipulation and other sorts of violence that they may not categorize. And I think that's really illustrative based on how people identify themselves, and making sure that those survivors have access and awareness of the resources that are available to them. It might mean connecting to a local program that can better help them with safety planning. They could realize that they need to leave their relationship, so they could work with a program on that. They may need to find housing. They may need counseling. They may need, the whole array of what people need. And sometimes it's just like a security deposit. Sometimes it's a new job. Sometimes it's to relocate their family. Sometimes it's childcare. It could be literally anything, but healthcare practitioners generally are not always aware of the intersections and don't always do a good job of screening and educating on these pieces. There are a lot of great organizations that are working at that intersection that I think are working to address that gap. But like we saw, there was that huge chunk of respondents that said part of why they're not getting services is because they haven't found a practitioner that they trust or validates them, which very much feeds into their experience of maybe they're experiencing something that a practitioner didn't understand, didn't support them on. And I think what we really just need to do is expand the ecosystem of support for survivors. It's been really heartening to see people do that, not just with the healthcare fields, but with the banking field, with the cosmetology field, with hair salons. It's really, really growing. And I think those partnerships are what we can all do and advocate for because those are the ways that people get services in their own communities.
To expand on that a little bit, I think a lot of the work, like a lot of the work of the DV groups, at least on the national level, is kind of like making sure that domestic violence is thought about in all of the different intersecting issues. So, right, like in healthcare, what does repro coercion look like? How do we make sure that like the big leaders that are doing all of the abortion and healthcare rights advocacy or thinking about reproductive coercion, including it in how they're advocating and what they're talking about. Same with the gun violence prevention folks. Same with the banking and economic security people. Like, so a lot of our work is like, of course, we're working on the domestic violence pieces specifically, but a lot of the work is making sure that we're elevating domestic violence survivors and how they interact in all of the systems that we work in. Miriam also mentioned like organizations working with healthcare to help educate them and make them more informed. And also, how do we make domestic violence advocates feel comfortable and confident talking about reproductive health? Because that's not obviously our area of expertise. And so we recently did a similar presentation on our report with Futures Without Violence's National Health Resource Center. So they have some pamphlets and information that could be helpful for folks as they're trying to conceive of how do I bring this into a conversation? Is it appropriate? What do I need to know? Kind of to get that confidence to be able to do that work. I also saw a question about where can folks find state laws around abortion rights? I know If When How has some kind of mapping legal landscape. I think Planned Parenthood has one.
So,
Miriam, anything come to mind?
really good clickable ones too are the Center for Reproductive Rights and Guttmacher. So Guttmacher, Guttmacher. Both of those have clickable maps where you can click on your state and it says what the status is. And even New York Times has a handy tracker that they update pretty much every day in terms of their advocacy. And then I think for the specifics, If When How's legal helpline, if it's just like an email question and you want to know some specifics, is actually a great place to email in terms of asking what something might look like.
Thank you so much. Additionally, we have a question from Monty who said, can you please reflect a little about this post-Dobbs phenomenon of accelerating criminalization of reproductive health care that, practically speaking, operates to normalize individualized gender-based violence?
Oh, sorry. I think you cut out for a second there.
Oh, I'm sorry about that.
Yeah, no worries.
I can read it again if that would be helpful. He said, can you please reflect a little about this post-Dobbs phenomenon of accelerating criminalization of reproductive health care that, practically speaking, operates to normalize individualized gender-based violence?
Yes, I agree with that point. I think that is why we included state-generated risks at the beginning, knowing that the state-sanctioned violence has been happening for decades, not just in a post-Dobbs world, which is new and we're trying to navigate, but states are seeking more and more control over the reproductive lives of individuals that live there. And also now we're starting to see even restrictions to travel. And yes, this is a form of violence. Like we will say it until, we're blue in the face, but reproductive autonomy and the ability to make decisions for your own life is critical to living a life free from violence. If you cannot make decisions about your reproductive health, let alone your general health, there's no way to live a violence-free life, right? You're going to be in harm's way in some way or another because you're not going to be able to make choices. We do see in the report that abusive partners will use any sort of tool available to them to try to harm, threaten, actually, commit violent acts against an individual. And we saw even before Dobbs came down as a Supreme Court decision and it just starting to be general speculation, people already reporting on our lines that abusive partners were using that as a threat. So yes, it is really disheartening and really frustrating. And I think all that we can do is try to continue to educate lawmakers and policymakers on the very real impact this has on people's lives, and not just about childbearing people generally, but the impact on survivors that live in the intersections. We know that certain survivors are going to be more criminalized, are going to experience more barriers than others. Everything from someone's race to their sexuality, to their disability status, to their gender identity, to their sexual orientation. Those are all compounding factors. So it's really frustrating. And I think all that we can do is organize, organize, organize in our communities and our localities and our states. We are trying to do the federal work. To be completely honest, it's not going anywhere very quickly, but we are seeing a lot of positives happening across the country. And even in the recent election, with states that maybe went in a different political direction, they may have gone a different ballot initiative and supported, abortion rights and reproductive healthcare rights in their own way. So that is really where we're seeing the most positives happen. And that is frankly what keeps me going.
Thank you so much. So I'm going to give us maybe one or two or a little bit longer to ask some questions. And then, oh, Monty says thank you. So I'll give another minute for some last questions before we end our webinar today. I just got one other question that asks, what are some of the key challenges and legal considerations for addressing reproductive coercion, particularly for marginalized communities? I know you talked about intersections and how identity plays a role. And so I think this question kind of goes hand in hand with that as well.
Yeah, I think some of the biggest key considerations are going to be around safety planning in particular, because what is an easy option for one survivor may not be an option at all for another one. From as simple as taking time off to work, to travel, to the financial implications of what it means to get an abortion or care for reproductive health care. I think that it just means that it really forces us to listen to what survivors want. A lot of the time, they know exactly what they need and they just need support getting it. And that is really what I would encourage us all to do. And if that option is not available in the community, in the state, in the locality, it's maybe getting creative about, what those other options are and leaning on those broader resources. Like if, when, how, having a legal helpline, people reach out to the hotline. I think people often think of us as crisis services, but people sometimes just reach out to us to figure out whether their relationship is healthy and whether they're even experiencing behaviors that are abusive. So it's really accessing those broad systems of support to figure out what works best for a survivor.
Yeah, I think every survivor's needs are unique, so definitely. Caroline said, I work at a rape crisis center in Texas, and we are seeing more and more clients who need to leave the state to access reproductive health care. Even though I know that this is within the law, it still feels scary, especially if the survivor decides to involve the law enforcement. Should we be concerned about future laws that criminalize abortion retroactively?
I think it is something that is definitely a broader concern. Retroactive criminalization is something that's a little bit harder. This is another place where I'm like, hi, if, when, how, fangirl, but they do an amazing presentation, and we actually cross-trained at the hotline our advocates, and we cross-trained their advocates. So that's actually another resource that I would reach out to for their criminalization pieces. They do a whole explainer with all of their lawyers that tell you what you could do legally, what you cannot do legally, and everything in between. And I think that really helps in terms of organizational prioritization for what you're willing to do, what you're not willing to do, what you may be liable for and what you're not liable for. So that, again, I would reach out to them. They provide great training in TA, and they're very, very, very generous about their time and their willingness to do training for literally anyone who would find it valuable. So I think that criminalization matrix would probably be really valuable for your work.
I had a thought going back to the last question about reproductive coercion within the broad abuse or domestic violence concept. And as I was reflecting on it, I was thinking that, people's like just sex, abortion, birth control, like what we do with our bodies is just generally often thought of as something that you don't talk about with other people, right? And combine that with like what we saw earlier, which is like a lot of folks don't identify as having experienced reproductive coercion, like in an abusive context, right? And so I think maybe one of the barriers as we're thinking about reproductive coercion is just one, people's knowledge that that's like what they're experiencing and identification with that. Um, and two, their comfortability with talking about that aspect of the abuse that's happening to them, right? And so I think there's maybe additional barriers, especially for folks in particular communities, right? Miriam and I were just on a conversation. We were talking about faith-based communities, like especially for more conservative communities, right? To talk about this, there could be an additional barriers, right? About talking about sex life and all that's engaged um, in that piece.
Yeah, also using like spiritual abuse to coerce. All right, thank you so much. We really appreciate it. All right, so unfortunately, we've come to the end of our time together today. A big thank you to our speakers, Dorian and Miriam, for sharing your extensive expertise and knowledge on reproductive coercion. This was an extremely eye-opening and informative conversation. So thank you for all that you do, and also the rest of the folks at the hotline do. And of course, a huge thank you to everyone who attended this conversation today. Your participation, questions, and willingness to learn something new are what always make these discussions so impactful. In the coming days, please just keep an eye out for an email with the recording, the transcript, resources, and more. Thank you so much again, everyone, and we hope to see you next time. Big thank you to our two speakers as well. Bye, everyone. Have a good one.